Today, I am joined by Premier Surgical Dr. Anna Wilson, who's a surgical oncologist, and we're talking all about thyroid disease, overactive, underactive. About 30% of Americans have that, and so we want to talk all about the symptoms and what people need to know. So thank you for joining me today.
Thank you for having me.
Of course, so let's just go ahead and get right to it. Explain what thyroid is and some of the problems that may develop with it.
Yes, so the thyroid is it's an endocrine organ that's in your neck. It's a butterfly-shaped organ that lies right over your trachea, and it secretes thyroid hormone. So the most common problems that people have are either too little of that thyroid hormone is secreted or too much. And that's called hypothyroidism or hyperthyroidism. Patients can also have nodules in their thyroid, and most of the time those are benign, but sometimes they can be thyroid cancer.
Right, and speaking of that, what are some symptoms for thyroid disease and cancer so people can look out for them?
Yes, so symptoms of too low thyroid hormone or hypothyroidism are things like weight gain, lethargy, cold intolerance, or changes in the skin or the hair. Symptoms of too much thyroid hormone being secreted are the opposite, so more like weight loss, heat intolerance, and sometimes those patients can also have kind of a racing heart rate or high blood pressure. Symptoms of thyroid cancer usually are actually fairly asymptomatic. They present more as like a lump in the neck, either in the middle where the thyroid gland is, or sometimes off to the side where the lymph nodes are.
And those are some things that people need to be looking out for, especially since they are asymptomatic and can go under the radar really easily. And so let's just say someone does think that they need to be treated for this. What is a good candidate for someone that does need a thyroidectomy, which is basically removing the thyroid gland?
Right. So the reasons that we remove the thyroid gland are if there's a cancer in it, or if there's a nodule or a goiter or enlargement of the thyroid that's causing a lot of symptoms for the patient. So that can be anything that's caused by compression in the neck, things like difficulty swallowing, changes in the voice, or sometimes patients will get kind of a choking sensation when they lie flat on their back too.
And so let's also talk about lifestyle changes, whether before or after a thyroid surgery. What are some things that people need to be changing in their lifestyle?
Well, the main thing is to make sure that patients have iodine in their diet. That kind of helps control your thyroid gland and prevent goiters from happening. After a thyroidectomy, the main thing is that when the entire thyroid gland is removed, patients have to be on lifelong thyroid medication to replace the hormone that was previously being secreted by that gland. A lot of the time we can remove just half of the thyroid, either the left lobe or the right lobe. And in that case, most of the time, patients don't need any medication after surgery.
And you mentioned iodine as being a huge part of someone's diet for someone experiencing thyroid problems. What are some places and foods that you can get iodine nutrients from?
Well, the main place that people get it from is salt. Most salt is iodized. And so generally in developed countries, it's not too much of a problem because we all have plenty of salt and iodine in our diet without really having to think about it. But it can be more of an issue in third world countries and other places where those things aren't as prevalent in the diet.
Thank you so much, Dr. Wilson. Is there anything else that you want people to know about thyroid disease and how it can help them?
Well, I think it's important for patients to know that it's just very common to have problems with the thyroid, and most of those problems can be diagnosed fairly easily with a simple blood test or an ultrasound of the neck. It's very common to find nodules in the thyroid when an ultrasound is performed. Anywhere from 20 to 60% of patients will have a nodule. And most of those nodules are benign, but about 5% of them do represent a cancer. The good thing to know is that most thyroid cancers are very easily treated. They can be treated with surgery alone, and they have a very good prognosis. So if we can catch it at an early stage and do surgery, most of the time that's all the patients need.
And that is the good news there. And like you mentioned, a healthier diet will be able to help you in the future with thyroid disease. And thank you so much, Dr. Wilson, for giving us all these amazing tips on thyroid disease, overactive, underactive. Thank you. And for more information on all of this, you can visit Living East Tennessee.